Dr. David Bull's Sunday Surgery.
Now, this is a really interesting article. It was pretty much reported in every single newspaper, but apparently, according to experts, obesity, which we talk about a great deal, is overdiagnosed. These experts want a new, fat but healthy label. So a group of scientists around the world has proposed this radical overhaul of how obesity is diagnosed and treated. This is part of a Lancet commission. At the moment, we use something which is called BMI, the body mass index, which essentially is a calculation with your weight and your height, and you come up with a number. Depending on the number, it then says whether you are overweight, whether you're obese, whether you're clinically obese. They say that this is out of date. They say that actually what we need to look at is waistband measurements, waist to hip and waist to height ratios, direct body fat measurements as well. Now, loads of people, loads of very clever doctors, 76 global organisations, including the Association of British Clinical Diabetologists, the Association for the Study of Obesity UK, all on board with this. They say actually they need to decide if you are overweight or if you are deemed to be heavy and you have clinical problems, then that is when you need to worry. I would question that, but then who am I to question that? I just think that actually this is about a bit more of self-control. Vicky Godfrey, nutritional therapist and co-founder of DNApal, joins me now. Good morning.
Good morning. Hello.
Really good to talk to you. Look, maybe I'm being draconian here. We have a major problem with obesity in this country. We know that. As a result of that, people get ill, they get ischemic heart disease, varicose veins, diabetes, osteoarthritis, you name it, they get it. We are seeing terrible nutritional diets being sort of consumed by people. The advent of fast food, what we call empty calories. People are getting fatter and fatter and fatter. And now, I know all these clever experts are saying, oh, look, we need to say you're fat but healthy. Where do you stand?
I mean, you mentioned about the BMI and is it outdated? I think it is in a way, because there are certain elements that it doesn't take into account. It doesn't take into if somebody's pregnant.
Yep.
Muscle weighs more than fat.
Yep.
So if you're athletic, you're going to look heavier, from a weight gain, but you're going to look in proportion. So I do understand there are some other things that need to be taken into account, measuring fat. The fat around the middle is the most dangerous. It's VAT, but not in the money sense, but visceral adipose tissue. And we do know that that can cause fatty heart, fatty liver. So I do think the fat around the middle, to look at it from a doctor's perspective, should also be brought into the picture of, obesity, because it will cause problems. And like you've highlighted with chronic disease, a lot of chronic disease is driven by inflammation. And a lot of the food that is on the supermarket shelves, full of sugar, full of E numbers, full of toxic preservatives, all go on to give the body inflammation or encourage, inflammation. And that picture there, that fat around the middle is the most dangerous in the body. It's not so bad if it's around the thighs or the bum, but that middle fat.
But Vicky, this is what I see in the high street every single day. Almost, not everyone, but a lot of people are looking more and more like that.
Now, but I look in people's trolleys. Do you ever look in the trolleys?
Yes, I do. It's my favourite pastime, actually. And I also look to see the colour, the colour of the goods that they're buying. Everything is white.
Yes. Or some people can barely walk as they're holding their trolley. Their trolley has become their Zimmer frame. And then I look in and it's all packaged ready meals. It's white, like you say, the white bread or 5 bottles of fat Coca-Cola in there. Or they might have the Coke Zero in there, but the Coke Zero is just full of chemicals that is not going to do your body any good nutritionally at all. And the weight is just going on and on and on. So I agree, but there needs to be a bigger change towards farm to plate.
I agree.
From the farm, if it looks real, obviously you don't want a live cow on your plate, of course not.
Well.
It really is. We need to go back to the old days before processed food came out. There wasn't fat people after the war, certainly not in the levels that we're seeing it now.
Well, and you make a brilliant point. In fact, the ration book, which was introduced, gave you very balanced nutrition, which is what we are not seeing currently. Look, I understand what these doctors are getting at, and they're saying, well, we need to have better metrics. Most clinical settings do not have advanced metrics where you can measure all of these things. And actually, I do think we need to say to people, there is personal responsibility here. If you eat like this, you are going to be fat. And then there's a big question of who picks up the pieces. Well, the answer is the taxpayer.
Yeah. Yeah, because it's more stress on the NHS for things that people could take responsibility for. There is a little bit of a slight difference with genetic testing.
Yes, this is your thing, isn't it? Tell me about that.
Yes, so there's two genes that I find fascinating within this weight loss arena. One is the FTO gene, and the nickname is the fat gene. So some people can be predisposed to being fat or larger, but it doesn't mean it's their destiny. With genes, the genes are the loaded gun, and your diet, lifestyle, and choices and supplement choices pull the trigger. Okay, so if somebody does show up with a high impact FTO gene, the first thing we do is we put them on, protein with every meal. The FTO gene absolutely loves exercise, and all the research shows physical activity really brings that gene back into, balance. And then we've got the LEPR gene, which is about not being satisfied. So if you've got that gene, what it means is that going from your stomach to your brain, the neurotransmitter to tell you that you're satisfied and you'll feel full, is a little bit delayed. So therefore, people can eat their full meal, know what it's on their plate, and then they're just not satisfied, and they go back and they pick and they pick and they pick. So again, eating slower, chewing. I mean, I don't know how you eat, but I'm a two chew a gulp.
Two chew a gulp. I was going to say this idea is a really good one, because back in the day, you sat at a table. You had conversation. So therefore, you masticated, you chewed your food much more, and then you swallowed. Now, people throw it down their throats, and of course, you don't get the satiation that you would if you ate slowly.
That's right. And how many people do you see put down their knife and a fork halfway through the meal just to carry on their conversation, and then pick up their knife and fork? They don't. It's very fast meal times now. The ideal amount of chewing is 25 times.
Wow.
And when I've worked with clients, I'm saying 25 times, and they're like, you're joking. I'm like, chew twice and swallow. But then the digestive system has to work harder, because your teeth that are supposed to do the job means your stomach acid has to work harder to break that food down, because you haven't chewed it, masticated it as much for the digestive system. So you're putting more stress on the digestive system.
Can I just ask you about this idea about a set point? When I was much younger, I was much heavier, as people say. I then incorporated exercise, as you say, my genes like that, but also much more regimented in what I eat, so I don't have carbohydrates late at night, because I find that doesn't work for me. But I know a lot of nutritionists talk about a set point, that we go back to a set point and then we oscillate around that set point. So if you are heavier, is it possible to change your set point, your norm?
100%. 100%, I think. And the body is so wonderful, and the body can heal from so many conditions. We can easily bring it back into balance. But again, it's about putting the right things in at the right times. And as you've noticed, carbohydrates give you energy. So eating carbohydrates at night before bed, where is that extra energy going to go? Well, it's going to go in your fat cells, because, in the old days, when we didn't have as much food as we have available to us now, the body would take the energy, store it into the fat to be used later on when we didn't have food to use for energy. And now we're so overconsumed in this society that we live in. So it means that the carbohydrates is just going to go straight on your tummy, straight on your thighs, because there's no time to burn it off unless you're going to have some fun nighttime activity.
Good Lord, it's 9:20. Can I just ask you about this? Certainly when I was growing up, we were told always as children, you finish your plate because it's good for you. And that is the common rule for generations. And now there was an article which was in the Daily Mail this week saying 4 in 10 parents say they make their children eat everything in front of them. But the headline says, don't finish your dinner. Parents are fueling obesity crisis by forcing their kids to eat huge plates. This is according to the British Nutrition Foundation. I don't buy it. Surely it's about what you're eating.
When I was sent the headlines through, that was exactly my first reaction, is that the food that is probably going on their plates is probably quite highly processed, not cooked from scratch, full of sugar, full of preservatives and E numbers, all that can add to weight. It's a chemical, just lots of chemicals flying around the body. There's no nutrition to the cells. Then the cells aren't going to behave the correct way.
So I was just going to say, Vicky, my take-home messages are eat sensibly, everything in moderation, and get some nighttime activity. That's what I learnt from you this morning.
Can I just add one thing? My son has the overeating gene.
Right.
And he's perfectly in balance. And he can eat 2 burgers, two jacket potatoes in one meal in the evening. Homemade, I might add. Wild, homemade, organic burgers, not from the shops. That I wouldn't eat that. And he is perfectly in balance. He trains football 4 times a week. And they just don't get given the wrong foods. Obviously, as a nutritionist, that would be a bad look for me. But their bodies are in balance, however much they eat. And he can eat. He can eat the size of an adult at 11 years old, and he's not fat.
Right.
Proving my point that the right food. Sorry, go on.
No, I was going to say I'm popping round for a burger later.
Yes, I make lovely ones, lovely homemade wild grass-fed burgers.
Well, I can't wait. Vicky, thanks ever so much for your time this morning. Vicky Godfrey, nutritional therapist and co-founder of DNApal. Really good to talk to you. That was today's Sunday Surgery.